This presentation is brought to you by Brain Core Therapy. Many sufferers of myofascial pain syndrome also suffer from fibromyalgia. But how are the two disorders similar and how are they different? Well, today that's what we're going to discuss here. Myofascial pain syndrome and fibromyalgia are two similar disorders that can drastically reduce the quality of life for those who suffer from it. Oftentimes, those that suffer from one also suffers from the other, and other times patients are diagnosed with one when they actually are afflicted with the other. Both fibromyalgia and myofascial pain syndrome are characterized by extreme sensitivity and pain in the absence of trauma or injury. They both cause sleep disturbances, and the chronic levels of pain can cause depression and anxiety. They also both occur alongside chronic fatigue syndrome. Myofascial pain syndrome usually manifests as a pain and sensitivity in specific muscles or parts of the body, while fibromyalgia tends to affect the sufferer generally, whereas they feel sore and sensitive all over their body. People with myofascial pain syndrome have trigger points, which are hard knots in the muscle that can cause pain in both the trigger point and elsewhere along the nerve. This is not the same as a tender point for fibromyalgia. A trigger point can be eliminated with the right therapy, whereas fibromyalgia's tender points are chronic and much more difficult to treat. Where fibromyalgia is a neuroendocrine disorder, meaning it affects the brain's neurotransmitter cells, myofascial pain syndrome is a neuromuscular disorder, meaning that it affects the nerves that control the voluntary muscles. The most important distinction between these disorders is the fact that of the two, myofascial pain syndrome is easier to treat because there are specific treatment plans that work for most people. If you suffer from both conditions, seeking out a treatment that can alleviate the symptoms of myofascial pain syndrome can also calm the pain that results from fibromyalgia. Electromyography biofeedback has become a popular and effective therapy for sufferers of myofascial pain syndrome because it is safe, non-invasive, and doesn't involve medications. Biofeedback helps the doctor understand where a patient's trigger points are and can help a patient learn to regain control of their improperly regulated muscles. Biofeedback for myofascial pain syndrome comes in two varieties. The first being static procedures, which are used to find tension in the muscles. Secondly, dynamic procedures, which can help to correct the muscle's electrical characteristics and restore imbalances in the body's biomechanical processes. If you are suffering from myofascial pain syndrome, talk to your doctor about learning to manage it with biofeedback right away. It may be just the therapy you need to start living a pain-free life. For more information or to schedule a consultation with your local Brain Core doctor, please visit our website at www.braincoretherapy.com.